I'll tell you about precautions when a beginner does FNA. There are many significant structures in the neck. When doing FNA at a thyroid nodule or a nearby lymph node, beginners are prone to miss them. So, I've organized it. Depending on which way the needle enters, FNA is performed both horizontally and vertically. It doesn't always go in, at 180 degrees and 90 degrees like this, when performing FNA. It can enter obliquely. When you get the specimen well, and carry out the procedure without any issues, it's acceptable. Although the FNA needle for a thyroid nodule used in my breast and thyroid session is usually the thinnest. Many doctors take longer to adjust to thyroid FNA than breast biopsy, which is usually done with a thicker needle. The cause could be that the patient's face is in front of the doctor, which makes the doctor nervous. Beginners may be even more embarrassed when the patient's carotid artery pulsates strongly. Prior to the procedure, it's crucial for novices to decide which needle route to use. There is a nodule at the right thyroid. How do you plan in this situation before inserting the FNA needle? The needle can go either obliquely or vertically, I believe. When the needle is obliquely inserted, be careful not to poke the common carotid artery. In this patient, a small recurrence was suspected at the right operation bed. She underwent a total thyroidectomy due to cancer. If the needle is inserted vertically into a lesion that is close to the skin, the to and fro motion may not be as stable. Therefore, entering the needle obliquely can be a wise choice. The examiner entered the needle at an angle. The patient complained of severe pain during the FNA procedure. Later, the ultrasound showed the hematoma within the carotid wall. This is the subendothelial carotid hematoma, caused by the needle puncturing the common carotid artery during FNA. In the event that this issue arises, the patient complains of unusually sharp pain. In this case, the examiner should stop the FNA immediately. After hemostasis, most things get better. In this case, the thyroid nodule is also located near the common carotid artery. The patient complained of acute discomfort after the examiner positioned the needle obliquely. Thus, FNA was stopped by the examiner. Ultrasound revealed a subendothelial carotid hematoma. If the patient complains of exceptional intense pain, rather than usual discomfort during FNA, the operator should pause the procedure and use ultrasound to diagnose the problem. Why don't you approach the needle like this? Because you're afraid of hurting the common carotid artery. This is not suggested because the recurrent laryngeal nerve runs along the trachea, and the ultrasound does not reveal it. There is a superior thyroid artery in the front of the thyroid gland and an inferior thyroid artery in the back of the thyroid gland. On ultrasound, you can see a small hypoechoic structure along the thyroid gland. You can see the pulsation if you look at it on a real-time ultrasound. There is a suspicious nodule at the left thyroid. A core biopsy was performed at a local clinic. The superior thyroid artery is visible as a round hypoechoic structure. This artery is adjacent to the core notch. Following core biopsy, hematoma occurred. There is a suspicious nodule in the right thyroid. The inferior thyroid artery is seen behind the nodule. At an outside clinic, a core biopsy was performed. The common carotid artery is too close to the core tip. Thankfully, there were no issues with the common carotid artery. However, hematoma developed behind the thyroid gland following a core biopsy. It is thought to be the problem caused by touching the inferior thyroid artery during biopsy. The patient was diagnosed with thyroid cancer at an outside clinic. The examiner suspected left level 4 lymph node metastasis. There are many important structures around the lesion. In this case, which direction should the needle go in? I think I would enter the needle in this direction. As you can see from the FNA image on ultrasound, the lymph node was well targeted. The vagus nerve, however, is visible close to the needle. Luckily, the needle did not contact the nerve. Vagus nerve lies between the internal jugular vein and the common carotid artery. It may be seen between the thyroid gland and the common carotid artery. When performing lymph node FNA, you must be cautious around this structure. Thank you.